Hello there. Thanks for coming to my presentation. My name is Rama, and I'm here to talk about our study on misinformation engagement practices around WhatsApp. This work has been done with my awesome collaborators, Joyojeet from University of Michigan and Aditya from Cornell University. With popularity and uptake of social media services in emerging economies, the risk of misinformation are also rapidly multiplying. Such risks are disproportionately higher in low-income communities where misinformation can often manifest into devastating effects such as lynching, riots, and deaths. Despite the increased negative consequences that misinformation can have on rural communities, most of the prior research has explored misinformation engagement in the context of urban communities who have grown into social media on mobile platforms after being internet users for a long time. In contrast, little is known about misinformation engagement of rural communities who are new adopters of social media. We take inspiration from limited literature that is available in this area to first understand end-to-end engagement of rural participants around misinformation on closed WhatsApp groups, and two, compare and contrast practices with that of urban communities to find commonalities and differences. In order to answer our research questions, we recruited 19 rural and 9 urban participants to conduct our qualitative interviews. For our interviews, we reached out to participants before the session and asked them to shortlist specific COVID-related messages from 1 to 2 WhatsApp groups. This practice allowed participants to narrate broader events that were related to message in the question. In-depth details about data analysis are mentioned in the paper. Our overall findings are divided based on different types of engagement that participants described around misinformation messages. Keeping the length of presentation in mind, I will briefly go over some of these practices. Our findings show that marginalized users in rural communities, such as women, laborers, and older individuals, lacked smartphone ownership and therefore access to WhatsApp groups that contained COVID-related information. As a result, they were dependent on intermediaries in power like breadwinners, community health workers, and village council members to consume COVID information from these WhatsApp groups. Intermediaries in turn controlled the narratives and shaped participants' perspectives on what information was considered misinformation or authentic. In our investigation, we found that intermediaries shared multiple messages that were misinformation, thinking they were accurate and provided advice around it. In contrast, urban participants did not experience such control on what information they could consume because of their uninterrupted access to WhatsApp groups. But their perceptions were often shaped by in-network influencers, especially those people in the close circles such as family and friends. In the event participants stumbled across any information, they used contradictory or contrasting practices to verify whether it was misinformation or not. Urban participants used their tech savviness and awareness to test credibility. While Googling was a common strategy, cues in the message content such as unusual number of emoticons or lengthy text raised suspicion. We also found that in certain groups, individuals with credentials like a medical nurse performed invisible labor of watching and alerting the group if they found any member sharing misinformation. This was an implicit responsibility that was entrusted to them to keep COVID-related misinformation in check. On some occasions, members of these groups even reached out personally to the gate watchers to understand the authenticity of these messages. In contrast to their urban counterparts, rural participants leverage offline public spheres like in-person congregations where they read suspicious messages out aloud and sought groups' perspectives to verify if a message was authentic or not. The authenticity of the messages were determined by everyone sharing their own contextual experiences around it. Despite employing different verification strategies, participants admitted to sharing misinformation in several instances. Both urban and rural participants shared misinformation messages that instilled fear and caution in people's mind so that they would follow COVID-related protocols. Participant 9 was one of many participants who crafted long, inaccurate messages to scare members of their community to follow COVID mandates. In some extreme cases, Participants took a communal angle when they shared misinformation, maligning other communities to protect their own community members from the risk of COVID. We saw multiple variations of messages that falsely targeted Muslim communities for purposefully spreading COVID. We also saw several marginalized participants in urban and rural areas, especially women, who were unduly coerced by other members of communities to spread misinformation. For example, participant 6 described how her husband, who sold homeopathic medicine that had no medically proven benefits, coerced her to share messages of the product to her network and put them as status messages. Finally, we also saw interesting differences between two communities in terms of combating misinformation. Participants from urban communities used ameliorating strategies that were focused on diffusing the tension while encouraging the sender to critically think about their messages. For example, users used soft pushback strategies like sending educational resources in the group in response to the messages or using soft nudges like, "Can you please check?" In contrast, rural participants found a strong need to push back against hyperlocal misinformation that personally affected them, contributing to altercations in offline public spheres. To minimize the altercation, community leaders often used strategies that targeted large parts of rural communities at once. One method was repurposing garbage trucks, also called as Ghanta Gadi, with mounted speakers. These trucks visited all the main streets with announcements dispelling misinformation caused by WhatsApp messages. In our paper, we further build on our findings using lens of public sphere to show how certain qualities accelerated or inhibited the spread of misinformation. We also provide different strategies to safeguard the interests of marginalized users who often are restricted from accessing online public spheres of WhatsApp. For more details, please do read our paper. Thank you for attending my talk.